most sickle cell patients get treated with meds. I was on meds when I was in school. I was on Vicodin or Tylenol or ibuprofen or whatever you use to get rid of pain, because sickle cell, essentially what it does is causes severe pain. Well, as I was 20 years old or so, I was in college. I was around 20 years old, and I kept having these strange allergic reactions that were slightly weird, if you could imagine. I was having, my eyes were swelling shut, my face was swelling up, I was having hives and itching, slurred speech, and I could not figure out what this allergic reaction was. So I kept going to Dr. Williams. At the time, he was my hematologist, and I was like, Dr. Williams, something's wrong with me. I was taking pictures of myself, taking him to him, like, that's how I look when I get these weird reactions. And he was like, well, we're going to start taking away your lotions that you use and change your lotions, and then we're going to change, your foods that you're eating. Maybe it's a food allergy. So over time, we didn't figure out what it was. But one day I was sitting across the dinner table from my roommate. We were studying, and I had a cup of water, but I had a headache. So I was like, oh, God, I have a headache. And she was like, give me an Advil? She was like, yeah. I was like, you know what, give me one of those Advils. I need an Advil. And she gave me an Advil, and I was sitting there. Within 15 minutes, my face swelled up quite big. And I was like, oh, this is it. This is that thing that's been causing these allergies. So I was like, okay, well, no more Advil for me. So cut out Advil, and along with that, Tylenol goes, because Advil and Tylenol are closely related, and anything that contains them. So I found myself going to pain specialists to figure out what are other ways that we can use to treat pain, because unfortunately for me, I do live in pain. I mean, it's the story of my life. I was diagnosed with necrosis, which is the death of your bone in both shoulders, and I have it slowly forming in both hips, and that in itself, it causes extreme pain. It's a joint on joint rubbing together, causing friction, and for anyone, and including myself, it is very, very painful, and it just continues to get painful, especially when it's rainy, wet, cold, specifically cold. The cold weather, everyone says, why don't you live in Michigan? Because my family's here, my base is here. This is where I grew up. It's not just as easy to pick up and go, especially when you have something like this that's weighing you down. So as far as that, I'm right now, I'm still on my wit's ends with not taking medicines. I can't take medicines for a headache or for general pain. Every day I live in pain, and I have friends who have sickle cell as well. And fortunately for them, they can take a Tylenol or say, I'm taking an Advil and I'm gonna go to sleep. My brother can take an Advil and go to bed. I can't, and it has forced me to grow up a lot faster, I think. Also to understand what my limits are as a person. I am often called a workaholic. I have to go to work. My work provides me with health insurance, which provides me with the ability to get treated and seen by the best doctors there are at the U. So I do have to go to work, and work is very important, that they understand that just because I have an illness does not mean that I'm not going to be available to them to work. So within all of that, I have my family life and my home life. My mom and dad, who are constantly looking out for me. My parents take very good care of me. My mom is often there, and she spends the night with me when I'm in the hospital. At check-in, my dad's there, and then my dad usually leaves because he has to work, and my mom doesn't, and she stays with me. She'll stay with me for 3 or 4 days until I ask her to go home and get some rest herself. She does live with me, and up at the hospital, she'll stay in a chair or in the bed with me if she has to, and because I want her there, because I have, as I've gotten older, lost the cognizant ability to communicate with people and tell them what I need, whereas she knows what I need. She can tell, she's thirsty. Mom catches all of it. She catches the anger, the frustration that I feel, because there's tears of anger, because I am a very self-controlled person. I like to be able to take care of myself. I pride myself in being able to do for myself. And when I'm in that environment, I can't do that, and it's very frustrating because I can't do that. I can't take care of myself. I can't potentially clean myself like I want. I can't brush my teeth like I want. I can't feed myself like I know I need to eat.